I once read that I am a single-issue candidate. This is furthest from the truth. For instance, the debates about healthcare are merely about access to care, coverage, and insurance.
Who's covered? What illnesses are covered? How much does my insurance cost? What is my deductible? Who will insure me? Are existing conditions covered?
I run on the Humane Party platform because we believe healthcare should address sources, not just symptoms. It should ask, what's the best choice, not just how will the bill be paid. Our national healthcare must emphasize disease prevention and wellness promotion, a proactive approach that is significantly more cost-effective than that of simply waiting for health problems to arise and then treating them. Today's model is a slave to revenue and insurance companies, and doctors operate under this model and bill you through insurance companies using what's called International Classification of Diseases, or ICD coding, and Current Procedural Terminology, or CPT coding. Now, when I worked as a federal contractor for TRICARE, the military's healthcare system, I learned that ICD codes are used by a doctor to classify diseases, injuries, health encounters, and inpatient procedures in, I quote, morbidity settings. Likewise, CPT codes describe the physical procedures like injections, lab tests, and exams that healthcare providers perform on their patients. And while these are the codes used by insurance companies to pay doctors, in my many years working for TRICARE, not once did I see an ICD code that diagnosed a human being with sickness due to the consistent and prolonged consumption of another mammal. As a matter of fact, when my own father was diagnosed with cancer, I learned that he was diagnosed with an ICD code of 159, which is defined as a malignant NEO-PLASM. Now, in plain speak, according to the American Medical Association, a malignant NEO-PLASM means unexplainable growth in a living tissue. So you see, the system, the infrastructure used to address the ailments of our citizens does not work. In many situations like that of a cancer diagnosis, medical professionals are trained to provide an undefined diagnosis. In essence, I'm diagnosing you, but have no explanation of what it is. However, you and I know the truth. You and I have common sense. You and I possess logic, long ago forsaken and replaced by long words and medical jargon. And you and I know root cause. So while the other parties have focused the healthcare debate almost exclusively on how to pay for services, our party, the Humane Party, directly targets the sources of the health problems that plague our nation, from obesity to heart disease. So people say I'm a single-issue candidate. Well, I say I'm not.